This year's World AIDS Day commemoration is themed End Inequalities, End AIDS, End Pandemics. However, this has been tweaked to highlight the importance of sustained financing in the nation's push for the last mile of HIV epidemic control. Hence the theme End Inequalities, End AIDS through Sustainable HIV Financing in Nigeria. Hello and welcome. You're watching The Last Mile of NACA. I am Adesu Alsui. This episode brings you sights and sounds of numerous activities held to mark the 2021 World AIDS Day. Take a look.
The World AIDS Day commemoration every 1st of December is aimed at creating awareness of HIV and AIDS and issues around its treatment and prevention, as well as to remember those who have died from AIDS-related illnesses. The universal theme for this year is End Inequalities, End AIDS, End Pandemics. However, the need to refocus stakeholders' attention to ownership, sustainability, and the attainment of epidemic control in Nigeria saw a slight change to the theme nationally. Thus, End Inequalities, End AIDS through Sustainable HIV Financing. The National Agency for the Control of AIDS, NACA, organized several programmatic activities in the days leading to the World AIDS Day, starting with a press conference at its headquarters building in Abuja.
The Nigerian national response is at the last mile of its epidemic control. Therefore, the public and private sectors, the communities, all stakeholders in the national response have roles to play to ensure epidemic control and sustainability.
And we couldn't be at the point at which we are without all the partners here on the ground in Nigeria. And I can't be more proud than to be associated with the group of people that we have in this room, because together we all have our own niche and our own role that we're performing. And because we're doing it in a coordinated way, we are actually going to be able to end a public health emergency.
The next day featured a roadwalk and HIV testing services in select areas of the Federal Capital Territory.
One time.
Day 3. Muslim faithfuls in the agency, led by the Director General, Dr. Aliyu Gambo, were at the National Mosque for the Jumat.
We are bringing the message to the mosques because religion plays a critical role, especially in fighting stigma and discrimination. For people to know that if you stigmatize and discriminate because somebody is HIV positive, you are helping the virus. You're not helping us. And we want everyone to help us to control HIV. And the way to help us is, one, today know your status if you don't know before. And if you are HIV positive, we will protect and make sure that you're not stigmatized and discriminated against, and we will make sure you have access to life-saving medication, which has changed the life of many that have the virus and live the virus in this country and globally.
After prayers, officials of NACA carried out HIV testing and counseling services. Day 4 featured several sports activities as part of the World AIDS Day celebration.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols. Wear a face mask and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
A Thanksgiving ceremony was also held at the First Baptist Church, Gariki, Abuja, to commemorate the World AIDS Day. During the service, the Director, Research, Monitoring and Evaluation, NACA, Dr. Greg Ashefo, addressed the congregation.
HIV is the most death sentence, and that is why we encourage people to test. The number of death sentence if you know your status for your treatment and care. That's the good news about HIV. We are happy to be part of you today to thank the Lord for what He has done, that in this country we are reaching the last mile. And the last mile is saying that we are about to achieve great control. We need everybody's support, the church support, the faith-based, everyone's support. So we are here to create that awareness and also thank the Lord.
There was also HIV testing and counseling outreach after the church service. A media engagement and debate competition for adolescents and young people, AYP, was organized by NACA as a platform to reach the youths and other affected populations. In his welcome address, the Director General, NACA, Dr. Aliyu Gambo, stated that persons living with HIV who are not on treatment is as a result of inequality.
It may interest us to know that out of the estimated 1.8 million people that live with HIV in Nigeria, at the moment, we have succeeded in identifying and placing on treatment 1.6 million people. So if you like, you can say we have 200 plus more thousand to go. But we realize that these 200 plus want to go, it's not easy to find. These are the groups that we're referring to when we say end inequalities. So, and this inequality largely now affect the AYP.
Further in his remark, Dr. Gambo gave some statistics that underscores the existing inequalities with the demography in terms of access to HIV services.
It is important to note that 320,000 out of the estimated 1.8 million that live with HIV in Nigeria belong to this category, adolescents and young persons. More so, it is important also to know that among this category, there is rising new infection or new cases that have been detected, up to 24,000 annually. And still among this group, the females that are aged 15 to 24 have the lowest viral load suppression.
The wife of the president, Dr. Aisha Buhari, was represented by Special Assistant on African First Lady's Peace Mission, Dr. Mairo Almakura.
The challenge of inequality in accessing HIV/AIDS services, which is further deepened by the socio-economic disparities, has created an increasingly worrisome situation that requires collective action. I commend the commitment of NACA and other partners for their sustained strategy and inclusive efforts towards tackling HIV.
The debate session on whether the knowledge of HIV is important to the well-being of adolescents and young people was very insightful, after which the winner and runners-up were presented with prizes.
what we want people to know is that there is an act against HIV, stigma, and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
The next day featured a scientific and technical session themed Epidemic Control and a Sustainable HIV Financing in Nigeria in the Face of COVID-19. Finally, officials of NACA, relevant ministries, departments and agencies, implementing partners, civil society and community-based organizations, among other stakeholders, were gathered for the flag-off ceremony of the 2021 World AIDS Day celebration. The Director General, NACA, Dr. Aliyu Gambo, delivered the opening remarks.
World AIDS Day is that day when we come together to remember people who have lost their lives to HIV/AIDS, those who have sacrificed and fought HIV for the last 40 years and they are still fighting. And our patients that are out there that are battling the virus in their body and, helping us to have this hope that, yes, HIV can be controlled and the control can be sustained. And I want to say Nigeria is on the fast track lane to controlling HIV epidemic. So, and you may not be wrong to say Nigeria is among the foremost countries now on the watch list in terms of the race to control HIV. And this is courtesy of the collaborative work that has been done strenuously for the last 20 years.
Several goodwill messages were delivered, beginning with that of the Secretary to the Government of the Federation, Boss Mustafa, represented by the Honorable Minister of State for Health, Dr. Adeleke Mamora.
Since taking over the helm of affairs of the country in 2015, our commitment to the HIV response as well as the support from all stakeholders have significantly impacted the HIV response positively. We recognize the impact of the global financing environment and the need for shared responsibility in order to end AIDS in Nigeria by 2030. The federal government has consistently increased domestic resourcing of AIDS response by making available resources annually to place additional 50,000 clients on life-saving medicines. This has been included in the appropriation for the last 3 years. Also, exploring innovative ways of financing the response is yielding the desired result, as the private sector, through the leadership of NACA, has established the private sector funded HIV Trust Fund. It is heartwarming to know that we are closing the gap rapidly.
The Honorable Minister of Health was represented by Dr. Omobolanle Olowu, Director, Public-Private Partnership Unit. Senator Oladipo Odujiri, the Chairman, NACA Governing Board, and Honorable Minister of Women Affairs, Dame Pauline Talon, also delivered goodwill messages.
Let me begin by congratulating the Director General of NACA, Dr. Gambo Aliyu, and his dynamic team for taking the lead on this. As a one-time chairman of the board of NACA, my experience and my closeness to the grassroots reinforces the importance of political leadership built on teamwork to help end the AIDS pandemic. Finally, I want to assure you of the Ministry's readiness to work with you in sustaining the drive for financing the sector. I call on all of us, the ambassadors, to drive this process of intensifying advocacy and ensuring that we all are ambassadors in controlling HIV/AIDS.
The theme for the year is about sustaining the financing. Presently, most of the bulk of the financing is from international donors. Government of Nigeria, through His Excellency the Head of State, President Buhari, has graciously added 50,000 every year on treatment. But it's still a drop in the ocean. We need the private sector, we need the states, subnationals, to also join the fight.
The theme for this year, End Inequalities, End AIDS through Sustainable HIV Financing, reaffirms our commitment to mobilizing additional sustainable domestic financing for HIV and integrating financing for HIV within broader health financing. I am pleased to inform you that we have made significant strides with inclusion of antiretrovirals on the National Health Insurance medicines list. Nevertheless, the contribution from bilateral and multilateral donors will remain important to ending AIDS in Nigeria by 2030.
There were also goodwill messages by representatives of the Network of People Living with HIV and AIDS in Nigeria, Country Coordinating Mechanism Nigeria of Global Fund, UN System and US Government.
So we have approximately 1 million people living with AIDS are women, or HIV are women, 550,000 are men, and about 53,000 are children. And that's important to understand the dynamics of the disease. And that we have to reach the people who probably have the least access to healthcare, which is generally women, and make sure that every pregnant woman, as we've said, does not pay fees. They get antenatal testing. That way we can be sure that their babies are born without HIV. No baby in the US or in Nigeria needs to be born with HIV.
If we're able to identify everybody and put them on care, then we're addressing the inequality. Because we're able to mobilize people and about 1.6 on treatment, it's a good thing. But we must ensure those within close setting, the key population, and take action and eliminate all inequality issues. All what we are after, people to have access.
Let us remind ourselves on this World AIDS Day that inequalities affect us all, no matter who we are or where we are from. Let's work together to end these inequalities and invariably to end AIDS as a public health threat. We want Nigeria to build on the momentum that it has achieved and ensure sustainable financing of HIV through initiatives such as the HIV Trust Fund.
If you look at the inequality we are talking about here, to be honest with you, if we stay within the health sector, we're not going to move the needle. If we have to address the inequality we're talking about. For women, you gave us the data, the disparity between men and women. And of course, tied to the women is the children, which is our major, what I would call the Achilles heel of Nigeria's HIV/AIDS response. PNTC has always been there consistently, bringing us down. So it's a challenge to all of us, not just to NACA or NASCA, but also to Women Affairs, correctional centers, donors, and technical partners to come together to galvanize our resources, our know-how, and be bold to think and move outside the box to see how we can address that issue. Because until we address that, we may never close that last mile that we are all aiming towards.
Globally, people in custodial centers and other closed settings, including people working in custodial centers, are at increased risk of HIV. As the Nigerian Custodial Centers and the Nigerian Correctional Service, we believe that quality health service is important for correction in line with our 3 R's mandates of reformation, rehabilitation, and reintegration. Neglect of people in custodial centers and other closed settings will be detrimental to these core mandates of Nigerian Correctional Service. The HIV response in custodial centers and other closed doors settings should always be an integral part of national health response.
Commemorating World AIDS Day remains crucial as it serves as a clarion call to the fact that the fight against HIV is yet to be won. There is still a critical need for continued funding, increased awareness, improving education, and the fight against stigma and discrimination, amongst other competing issues.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. And that's our package. End inequalities, end stigma and discrimination, and we will be several steps closer to ending AIDS in Nigeria. Till next week on The Last Mile with NACA, know your status and take action. I am Ade Suwelsi. Thank you for watching.